Hey, Dr. Jerry Williams, Urgent Care 24/7 here to talk to you about a hot topic, COVID-19 vaccinations. I have a lot of people come to me, friends, family, patients, asking me about should I get a COVID-19 vaccine. And I understand this is a very politically charged topic, but I'm going to tell you as a physician, and as a physician who has a national urgent care company, so we've been on the front lines of fighting this disease, well, since the beginning here in the US. I'm going to tell you my opinion, and it's an educated opinion, but it's mine. I want you to know that I respect everyone's freedom of choice, and I think it's a decision that each individual has to make. But I'm actually here to encourage you to take the vaccine. We're dealing with a virus that is very unpredictable in the severity of infections. Yeah, we have trends. We have some folks who have comorbid conditions or elderly that we know put them at increased risk. But I've actually seen relatively young, very healthy people who have gotten the infection and done poorly. So that lack of predictability is quite frightening when it comes to COVID-19 infections. I also want to talk to you about the safety of the vaccine, because I know that's an issue, because these vaccines were rushed through because of the worldwide pandemic. But if you look at the safety of these these vaccines that have been given literally to tens of millions of people, hundreds of millions of people worldwide at this point, fortunately overall these are very safe vaccinations and amazingly effective. And while I know there's trepidation and the unknown is always scary, I tell my friends, I tell my family, and I tell my patients that I was vaccinated very early on in this process, and was actually led my company as the first to be vaccinated because I was asked to do so. I was asked to lead rather than follow. I was actually going to go last, and I was asked to please go first to show our over 300 employees that I was stepping up to the plate to get vaccinated very early on. And I tell my friends, family, and patients I'd rather take my chances with an overall very safe vaccine that is very effective than take my chances against a very unpredictable virus that can kill. Now, the other thing I want to talk to you about are side effects from the vaccines. And I want to talk to you about what's most common. And it's not anything to be afraid of. The most common problems are injection site reactions, where you get pain and swelling and tenderness at the injection site. And then a flu-like syndrome with fever and body aches and malaise and headache and just feeling badly, usually for a day or so, the first full day after your infection, a day or two. Those can be managed quite easily with Tylenol, acetaminophen, rest, pushing fluids, and getting plenty of sleep. And typically those symptoms pass pretty quickly. So faced with, say, a day or so of post-injection malaise and not feeling quite so great versus going through a COVID infection, they could be anywhere from minimally altering to your lifestyle to even life-threatening. I chose my personal choice to take the vaccine, and I encourage my friends, family, and patients to do the same. Hey, Dr. Jerry Williams here from Urgent Care 24/7. Thanks for watching the video. I hope you found it to be useful. If you could do me a favor, if you like the video, be sure to click on the like button. Also hit subscribe, and when you hit subscribe, click on the notifications and click the bell there. That way you'll be sure to be notified every time Urgent Care 24/7 and Affiliates releases a new video. And remember, life is 24/7, and so are we.